The next steps through ethical decision making is questioning the character and integrity of the person in question. So, based on the ethical principles and the scenario, Kara's character and integrity are questionable. So, when she really, what was the biggest problem in her approach was that she hastily administered informed consent. She did not consult a supervisor, and instead, she just sort of let the client go without really trying to get on the same page over the misunderstanding that happened. So at this point, we're also selecting an action. So the first thing Kiara could have done in a school scenario is to first consult a supervisor. So you never want to leave the student alone in that case when they've really confided in you about suicide ideation. So while you're consulting a supervisor, to do that, you could either call a supervisor or have them meet with you at inside of your office. You could actually have somebody else sit in your office while you find them, just making sure that the student is not alone. Then you can apologize to the student for not being clear about confidentiality previously. And then you would hold the student to do a psychiatric evaluation. Now, at this point, the student not having confidentiality agreement, not signing a written confidentiality agreement would be problematic for the counselor on the counselor's part. However, the risk for the student's well-being is too great for the counselor just to let the student go. So that would probably be the selected action that we would go upon. Now, after the student was or you could say after the student was let go, you could consult with a supervisor. Always consultation is a good idea because either consulting a colleague or a supervisor will also help you in terms of liability, but it will also help you look at the situation in a different perspective. Sometimes when you're a little bit in the middle of the dilemma, and especially when it is really onto your fault, you may not be very objective when you're making a decision. So after the student was let go, what you could do now after consulting is set up an appointment with the student to question the reasons why they have not been coming in and checking in with you. And then the school counselor could apologize and then determine the suicide ideation concerns at that point and see whether or not the student would like to continue coming to see her just to check in, or whether or not it would be the best thing to reach out. And I would think that the best thing to do is get after consultation, depending on what the supervisor says, is get the parents involved and they can decide what kind of intervention that they feel suits the student at this time. So, as I mentioned previously, it's always a good idea to consult. So, you could consult supervisors, you could consult colleagues, cohort members, previous fellow students that are in the profession as you, and there were different parts of this case scenario that Kiara could have consulted with a supervisor. She could have consulted first when she was made aware of the malpractice liability, but before suicide ideation came about. She could consult after the client started expressing suicide ideation, and she could even consult now when the client stopped therapy, canceled therapy, or stopped coming to the school counselor. She could still consult with the supervisor to see what would be the best way to go about providing the best support for this student. Then the last step is to implement the course of action that you selected and be ready for opposition. So, for example, if Kiara held a student for psychiatric evaluation and the student understood that Kiara was at fault for administering informed consent too early, or even if their parents understand that, they can hold Kiara to legal liability and sue her for what her mistake. Um, So that's something that, even though she chose the best course of action for the student's well-being, she would have to be ready to face the consequences that come with her mistake. Another thing that could happen is, after professional evaluation, that the school may choose to terminate her contract and therefore fire her from the job because of this mishap. Now, I feel that because the school also would be liable, they would take these kind of concerns very, very seriously. And when you consult with a supervisor, you're really taking the liability off of yourself alone, but also you're allowing the institution to also make the best decision for everybody involved. Now, when we consider the 9 steps of ethical decision making, how does this impact your analysis of the case study? Now, everyone can look at the same scenario in different with different lenses and different facets, considering different aspects of this case scenario. So when you're analyzing a case study, it could be that you're looking at this case study with the child suicide ideation as the most important, or the lack of informed consent as the most important, or getting parental involvement as soon as possible as the most important. So really looking at the 9 steps of ethical decision making, your analysis of the case study can look different for different with different lenses. This was our case for Kiara, the school counselor, or the counselor in question, and it really pertained to issues of informed consent. We talked about how this is correlational, or how this translates to a school counseling setting. We went through the 9 steps of ethical decision making on what the best decision for Kiara could have been, and we also determined that this action was both unethical and illegal because it not only impeded on important values as a counselor, but the counselor did have a legal right to be well informed of the counseling relationship before consenting to treatment or seeing the school counselor in any sort of way. Thank you.